Victor, for the introduction, and hi everyone. My name is Zijing-Zhang, and the work I'm presenting today is part of the knowledge transfer partnerships between Aston University and Arcadis Consulting UK. So our project is a 2.5-year project funded by Innovate UK, but this presentation is actually kind of a side project of the main 2.5-year project, and in the main project we are looking at the technical aspects of automated compliance checking of health and safety regulations in the UK, but this one would be more social and organizational related side of automated compliance checking. So this presentation is divided into 6 parts. First, I will present some related research background and summary of literature review. And secondly, I will highlight the research gaps we identified and the objectives of this study. Thirdly, I'll present the method, and fourthly, the results, and then followed by the discussion, and this is concluded by the conclusions and future work. So a bit of background for health and safety, and we all know that the architectural, engineering, construction industry is exposed to many health and safety concerns and issues. And actually, according to the statistics by Health and Safety Executive in the UK, which is the UK's Health and Safety Authority, the facilities in AEC industry are significantly higher than other industries in the UK. So actually, the runner-up for this graph is agriculture, forestry, and fishing, but it's actually only less than half of the facilities as construction industry. And also, we're looking at the infrastructure sector. The health and safety concerns even more because they are so complex and dynamic. And you can see the construction site has lots of construction workers and so many machinery working at the same time. Because of this, researchers have been studying health and safety through the design stage to improve the health and safety outcomes on infrastructure projects. And that is done by identifying the health and safety hazards during the design stage. And also with the recent advancement of digital technologies, and this is now moving into a digital aspect, and there have been actually 4 types of digital systems developed for this, such as knowledge-based systems, capture-related knowledge, and help prevent those things, and also hazard visualization using 3D models, etc., safety training using virtual reality, etc., and also automated compliance checking, which will be the focus of this presentation. Automated compliance checking, well, this is shown on the graph, it aims to assess the building design against regulations, and in this case would be health and safety regulations in the UK. And actually it's a quite complex process, involves a lot of actors and a lot of knowledge exchanges as shown in the arrows. And well, actually this is traditionally conducted manually, which we all found that is not efficient, and using an automated method would improve the efficiency and generate cost savings. ACC systems have been developed and studied for more than 50 years. However, not many have been developed for safety regulatory compliance, especially related to the design stage. And for those that have already been conducted, those research mainly on building safety compliance regarding fall protection, safety access, and egress, so all building related. And also most of the research is focusing on technical development, so trying to develop such kind of ACC systems. And also others look at success factors, such as the factors they highlighted, such as effective knowledge representation, interpretation rules, and accuracy and accurate and adaptable BIM data, and etc. So that's the success factors mentioned. So based on those literature review summary, we identified some gaps, such as there's limited research focusing on the social and organizational aspects of ACC. So what we mean social and organizational aspects could be related to the implementation of such system, because why is it useful if you can't implement that later in actual projects and in actual construction companies. And also, there has been limited research focusing on ACC in the infrastructure sector. So a lot of systems developed for the buildings, and actually, and the data model for the infrastructure sector, maybe the data is, is even more difficult to get the good quality data, etc. So, and also there's lack of research on automated compliance checking of health and safety regulations. And such kind of implementation in infrastructure design organization. So our objective in this paper is to have a snapshot of the current issues, gaps and requirements in digital health and safety management in the infrastructure sector. And we also want to understand the readiness of ACC adoption in that aspect in the design consultancy organization, and also propose some potential improvements to help the implementation of such system in such organization. So the method we use is an exploratory case study and a single case study to get an in-depth understanding of this explored topic. And firstly, literature review. We reviewed some related technology adoption literature, automated compliance checking literature, and success factors for ACC and ACC for health and safety especially. And secondly, is the main part of the case study. We did 5 semi-structured interviews with experts and 50 questionnaires with project managers, and also through the author's observation in that company. The validation part, we reviewed some secondary data, such as the documentation related to the company, and also the business procedures related to health and safety compliance, and also cross-validation from the other participants. And actually the results we presented include 2 parts. So firstly is the procedure of that company to achieve such health and safety compliance, which is the design risk management process for their compliance. It includes 6 steps. Firstly, they obtain relevant pre-construction information from the client, and secondly, they identify some constraints based on the existing pre-construction information. And thirdly, they produce the design risk management schedule, which is either a spreadsheet-based document or is a digital system, to identify hazard and risk levels at different spots on the project. And also they then develop the treatment, mainly hazard elimination or reduction. So they actually treat the personal protective equipment as the last resort. And then they review the design risk management schedule, and finally they hand over those residual risks in that design risk management schedule to the principal contractor. So with, in the interviews and also the questionnaires with the experts and the project managers, the 4 main themes emerged on the technology adoption in general and the ACC adoption specific. So first is the regulation aspect. So actually it's important to understand regulations to actually check them and achieve compliance, but they have different levels of understanding of CDM clauses based on their various experience, and also there's a lot of different interpretations of the ambiguous clauses. So if you are not familiar with the health and safety regulations in the UK, they're pretty much performance and outcome based. So it's really difficult to see, what exactly you need to design to achieve the compliance. And also, they don't currently have a very detailed matrix for assessing compliance. They only maybe have 10, 20 questions to ask for the whole regulation. And also, secondly, for technology, they have limited knowledge and understanding of ACC, and also this applies to similar digital systems. And also already, although this company already has some existing capabilities for the design risk management process, but they are not widely adopted, so they're still using spreadsheet-based solution most of the time, and also they lack high-quality data for ACC due to the nature of the infrastructure projects, and also because they don't have much focus on the automated compliance checking aspect. And thirdly, in terms of human factors and the culture, we noticed that they lack some competency in relation to their junior staff in terms of health and safety compliance. And also in terms of risk mitigation, the severity ratings, they have like various standards, so it's not like a unified standard. And also they have limited focus on health by design, although we talk about health and safety, not just safety. And also they have awareness of digital technology tools. And also some senior staff express their concerns regarding if we are increasingly using only digital technology, and how will the future generation of designers understand, you know, how the hazard risk identification mitigation actually works. And lastly, we also find the external environment is in favor of such things, such, for example, the authority health and safety executive and also the main client, National Highways, actually have initiatives on digital technology to improve health and safety aspects. So based on those findings, we actually propose some suggestions, such as regulations should have more detailed descriptions and maybe highlight the intentions of the regulator, and also the organizational compliance audit form should improve their granularity. This should be more detailed to actually understand if it's compliant or not. And also we need more standardization related to the data storage and formats of CDM documents. So in that way, we know that we are talking about the same thing when we refer to different level of risk, etc. And also, there needs to be more training for improved competency of employees. So there's no varied skills and experience related to this. And also the awareness for digital technologies, not still thinking digital technology can magically solve everything. And also there needs to be culture change. By highlighting the health aspects in health and safety in construction. And also there needs to be a national level initiative for risk standardization, so everyone's talking about the same thing. And for the discussion part, so previously there have been similar research in New Zealand and in the global study. And we found that, like other parts of the world, the overall readiness for ACC adoption is low in the UK's infrastructure sector. Sorry. And based on this low readiness, we propose some suggestions, such as more organizational knowledge sharing through internal review meetings, and improve standardization, identify priorities, and develop common language across different business functions, such as legal and design engineering. And secondly, the regulators should review the regulations and revise them for better clarity, relevance, and machine readability. And thirdly, also need to analyze organizational capabilities and gaps in implementing such ACC systems. And also we need the organization to provide more employee support and training, and have some maybe top-down or bottom-up strategies for culture change. And also we need some organizational investment in this area, so at least on some pilot projects, so that they will start to see the business value and the benefits can be generated from using those digital technologies. And lastly, they should improve the regulatory framework to provide guidance on health and safety. In conclusion, we found that low overall readiness on such ACC adoption in the UK, and we propose some suggestions for various stakeholders related to that. The limitation for this research is that we collected limited data only from one case study, so for future work, we are expanding this case study to include more experts to obtain the full picture. And also, as I said before, this research is actually, this big research is actually from the technical perspective, so we will continue to understand the requirements of project managers, designers to develop that system for better health and safety management. And currently, we have 1.5 years left on this project, so we will work on the stage 4, 5, 6, 7, and 8 to actually develop that system. Thank you very much, and if you have any questions or would like to know more about this big project, feel free to get in touch.